Dear boomers, today I am going to talk about the opioid/fentanyl crisis here in America. Um, it has been going on for quite some time, and when I was working as a nurse in the early 2000s, we worked at a place where I worked in a labor and delivery unit, but I also worked um, in a separate unit from the labor and delivery unit where people would come in with early pregnancy or what have you, and they suffered from chronic pain over their lives, and they would be getting opioids from us until I believe it was some sort of, maybe the American Medical Association clamped down on this, and they stopped us and doctors' offices, etc., giving out opioids for pain. And they didn't really give us a solution as to what to give them in the meantime. That was something that bothered me. We would send them to pain clinics, which, according to the patients who were sent there, it wasn't really very helpful. So last year, more than 70,000 Americans lost their lives to drug mixtures containing fentanyl and other synthetic opioids. While recent data suggests a decline in overdose deaths, the first significant drop in decades, this trend is not consistent across the nation. So, to grasp how we got here and where we are headed, we need to understand the history of the opioid epidemic. So, the opioid crisis, is often described as a series of waves. First, prescription opioid deaths surged, followed by heroin fatalities. But it wasn't until illicitly manufactured fentanyl entered the scene that overdose deaths skyrocketed to unprecedented levels. Once fentanyl dominated the drug supply, the outcome is almost inevitable. Whether a state enforces strict penalties or decriminalizes drugs, overdose deaths soared. Fentanyl moved across the United States, beginning on the East Coast, making its way to the West. Before 2018, over 80% of fentanyl deaths occurred east of the Mississippi. Now it dominates markets across the nation, killing tens of thousands each year. People who use drugs and those who work with them often recall a specific day when fentanyl entered their local drug supply. In some cases, emergency rooms went from handling a few overdoses a month to dealing with half a dozen in a single day. And that was the day when that happened that we knew that fentanyl had entered our community. Fentanyl is a synthetic opioid 50 times stronger than heroin, and carfentanil is even more deadly. Once these synthetics infiltrate the market, the death tolls rise sharply. No matter whether states impose harsh penalties or further progressive drug policies are pursued, nevertheless, it happens, and it's so sad. And I'm sure there are those of you out there who have lost loved ones to a fentanyl overdose. And I'm so sorry for that. Oregon is a state that decriminalized drugs for a time. Deaths surged there at roughly the same rate as in nearby states where stricter laws were enforced. This underscores a vital truth. Tougher laws and penalties haven't historically lowered overdose rates. In fact, the Centers for Disease Control recently reported a 10% drop in national overdose deaths between April 2023 and April 2024. But this data hides regional disparities because, especially in the West, where fentanyl arrived later and continues to drive overdose rates upward. Fentanyl's appeal to drug cartels is simple. It's cheaper and easier to produce than heroin. This is an unbelievable statistic. Heroin production requires large plots of land, farmers, laborers, and secure facilities. Fentanyl production requires only a few chemists, some chemicals, and a lab. The synthetic opioid is so potent that a year's supply for U.S. users could fit into a single trailer truck. The massive reduction in size and weight makes fentanyl nearly impossible to intercept at the U.S.-Mexico border, where thousands of trucks and cars cross every day. Disrupting the supply at this level remains an enormous challenge. So apparently, from what I read, fentanyl comes from China and then goes to Mexico, where these labs can create the fentanyl that kills our citizens. So what can we do? The answer lies in addressing the drivers of demand, not just focusing on the supply. Addiction is often an attempt to escape despair, trauma, and disconnection. We do have medicines that save lives, like Narcan, and I do in our state here. They do hand out Narcan at different intervals for free, as opposed to getting Narcan where you have to spend much more money from your doctor. So Narcan is an opioid overdose antidote, and methadone, which can cut the risk of death over 50%. But these treatments need to be accessible to everyone who needs them, not locked behind barriers. Ultimately, addiction stems from societal issues, isolation, poverty, and trauma, and it thrives in environments of inequality and hopelessness. Addressing these roots rather than punishing those who use drugs is the only way to reduce demand. Fentanyl has become the deadliest drug crisis in U.S. history. To stop it, we need compassion, science-based solutions that address the underlying causes of addiction. It's time for a new approach, but what is that approach? I know that even a fentanyl patch that comes prescribed by a doctor can also be deadly. And I will talk about something, not naming any names. This person was a friend of mine, a physician, whose son had just undergone knee surgery. And he was having some uncontrolled pain. My friend gave him a fentanyl patch, and when he went to check on him, his son had died. This was not any kind of patch that was laced with anything else. It was a patch that doctors give to people in the doctor's office, in the hospitals, etc. I just want to say that fentanyl in and of itself is very dangerous. We used to use fentanyl in the hospital to give to women who were getting epidural to reduce their pain during labor and delivery. I never really felt comfortable. There would be side effects of blood pressure dropping. There would be a lot of problems with numbness not really going away. And afterwards, there would be a side effect of headaches in the spine, so that they were spinal aches in the spine that were excruciating. And then they'd have to come in and get a patch and I believe it might have even been a fentanyl patch to do away with that pain. So we in medicine often have a laissez-faire attitude towards what is prescribed to our patients. Patients have a laissez-faire attitude towards pharmaceuticals that are prescribed to them. And it's about time, as one of my commenters in this YouTube channel mentioned, that we should just do away with, in our own lives, do away with pharmaceutical drugs. Now, everything has a place, and I know that we need to not have a rigid attitude. For instance, if you're a vegetarian, not to have a rigid attitude about meat. Or if you are an alcoholic and you're going to AA, hopefully, and you have given up alcohol, I think it's dangerous to have a obsessive attitude about alcohol. People can drink it and not be, and I know we have an epidemic of alcoholism in our society, don't get me wrong, but to have rigid attitudes about smokers, non-smokers, drugs, not drugs, vegetarianism, and that would include taking vaccines against certain conditions, or against the COVID virus. Taking vaccines is something that if somebody wants to do it, let them do it. Let's get some lack of rigidity here. Let's move forward with an open mind and a love for all humankind. There's going to be a video that shows up. Love to all.